Chapter 32, Abdominal and Genitourinary Injuries. This chapter will focus on abdominal and genitourinary trauma. The objectives is to recognize and manage blunt versus penetrating mechanisms, evisceration, impaled object. We will focus on pathophysiology, assessment and management of solid and hollow organ injuries, blunt versus penetrating mechanisms, evisceration, injuries to the external genitalia, vaginal bleeding due to trauma, sexual assault, vascular injury, retroperitoneal injuries. Introduction. The abdomen is the lower of the two major body cavities, and it is the largest cavity within the body. It extends from the diaphragm to the pelvis. It contains organs that make up the digestive, urinary, and genitourinary system. Injuries to the abdomen that go unrecognized or untreated are the leading cause of traumatic death. Let's review the anatomy and physiology. Abdominal quadrants, 4 arbitrary quadrants. The diaphragm is the dividing line between the thorax and the abdominal cavities. Within the abdominal cavity, we have hollow organs, structures through which materials pass, more resilient to blunt trauma, and we have solid organs which are highly vascular, solid masses of tissue. Injury can cause severe hemorrhage, abdominal pain from penetration, or rupture has a slow onset. So you need to know the difference between your hollow organs, or know which organs are hollow, which organs are solid. Hollow organs spill their contents, resulting in irritation. Solid organs will bleed excessively because they are highly vascular. The genitourinary system. Urinary system controls the discharge of certain waste materials filtered from the blood by the kidneys. Kidney is a solid organ. And within the urinary system, we also have the ureters, bladder, and the urethra, which is hollow. The reproductive system controls the reproductive process. Now let's look at the pathophysiology. Injuries to the abdomen can be both open and closed. General pathophysiologic concerns. Hemorrhage can occur with external or internal blood loss. The signs and symptoms depend on the volume of blood loss, the rate at which the body is losing blood, revealed by assessment of neurologic and cardiovascular systems. Hypovolemia will lead to the patient experiencing agitation and confusion. Hypoperfusion will result in anaerobic metabolism and acidosis. Anaerobic means not enough oxygen present to create energy within the cell. Injuries to hollow or solid organs can result in the spillage of their contents into the abdominal cavity, which leads to irritation of the nerve endings. Pathophysiology. Peritonitis is intense, potentially life-threatening inflammatory reaction. Pneumoperitoneum results from rupture of a hollow organ, perforated peptic ulcer, recent abdominal surgery, or rupture of an abscess. So in essence, it's ear outside of the membrane, right? It's ear within the space between the membrane, just like a pneumothorax. So the ear is where it shouldn't be, and it's compressing the organs within the peritoneum. Closed abdominal injuries. Compression injuries caused by a poorly placed lap belt. Deceleration injuries occur when a person or the vehicle strikes a large immovable mass. Closed abdominal injuries. Crush injuries result from external factors at the time of impact. Shearing may cause tears from the ligamentum teres hepatis. Signs and symptoms: pain, tachycardia, decreased blood pressure, pale, cool, moist skin. Crepitus in the lower rib can be present. They may have cur sign, that's discoloration around the over the flank, and they can have discoloration around the navel. Injuries from seat belts and earbags. Seat belts occasionally cause blunt injuries to abdominal organs. There is a higher risk in small children and short people. Inspect beneath the airbag for signs of damage to the steering wheel, and if it's damaged, start to think about where on the patient caused it to be damaged and which area of the steering wheel is damaged. Open abdominal injuries. A foreign object enters the abdomen and opens the peritoneal cavity to the outside. Gunshot wounds and stab wounds are common causes. Evisceration, the bowel protrudes through the skin. Signs and symptoms include signs of bleeding and puncture wounds, tachycardia, evidence of shock, distended abdomen, rapid severe bleeding. Injury to the diaphragm. Penetrated or ruptured abdominal organ may be pushed upward into the thoracic cavity. So if the diaphragm is ruptured, the negative pressure that is created in the thorax can pull the intestinal organs into the thorax. The patient exhibits dyspnea or feel short of breath, abnormal respiratory sounds, and an abdomen with a sunken concave anterior wall will be present, which makes sense if the abdominal structures are being pulled into the chest. Causes, signs and symptoms of ventilatory compromise. Injury to the kidney. So injuries to specific structures. Injury to the kidney. Blunt renal trauma. Kidney becomes compressed against lower ribs or lumbar spine. Presents with pain on inspiration. Penetrating renal trauma is associated with injury to the liver, lung, and spleen. Injury to the liver. Penetration or rupture may lead to signs of shock because it's a vascular organ. It may bleed significantly. Must be suspected in all patients who have right side chest trauma as well as abdominal trauma. And when the liver is damaged, it can cause referred pain to the right shoulder. When the spleen is damaged, it can cause referred pain to the left shoulder. Injury to the spleen. Rupture may occur if the spleen is enlarged from the mononucleosis, results in large amounts of blood spill into the peritoneum. Suspected with fractured 9th through 10th ribs. Injury to the pancreas. Patients present with vague upper and mid-abdominal pain that can radiate into the back. It may lead to peritoneal irritation hours after the injury. Injury to the intestines and stomach occurs from penetrating trauma or blunt trauma. Rupture of the stomach causes rapid burning, epigastric pain, rigidity, and rebound tenderness. Injury to the urinary bladder. Blunt injury to the lower abdomen or pelvis often cause urinary bladder rupture. Urine may be spilled into the abdominal cavity, leading to intraperitoneal, extraperitoneal, or retroperitoneal rupture. Injury to the external male genitalia. Testicular torsion occurs as a result of trauma. Injuries to the testicle or scrotal sac may cause loss of fertility. Penis injuries result from blunt or penetrating trauma and sexual behavior or self-mutilation. Fractured penis occurs when an erect penis is accidentally impacted or bent too far at the shaft. Penetrating trauma from gunshot wounds can also cause penile injuries or penis injuries. Injury to the female genitalia. The uterus, ovaries, and fallopian tubes are rarely damaged. Penetrating trauma may result from stabbings to the lower pelvis or gunshot wounds. Signs and symptoms of shock with pregnant patients. Sorry, let me rephrase that. So, injury to the female genitalia, the uterus, ovaries, and fallopian tubes are rarely damaged. Penetrating trauma may result from stabbings to the lower pelvis, or it can be as a result of gunshot wounds. Look for signs and symptoms of shock with a pregnant patient. External injuries include soft tissue injuries. Determine the possibility of pregnancy before tests and treatment. Vascular injuries caused by blunt trauma to vascular structures in the intraperitoneal space. Assessment findings differ depending on whether bleeding is contained or active hemorrhage is present. Results in abdominal aortic aneurysm, AAA. Patients present with rectal bleeding caused by sexual assault, can be caused by sexual assault, rectal foreign bodies, hemorrhoids, colitis, or ulcers of the digestive tract. Patient assessment. Cause of an abdominal or genitourinary injury may be readily apparent. During examination, expose only what is needed and then cover what was exposed. See incisor. Look for indicators of MOI. Inspect the object of penetration for penetrating wounds. Patients may avoid discussing genitourinary injuries. In your primary survey, evaluate the patient's ABCDEs, follow the XABCDE as needed, keep the airway clear of vomitus, and assess the patient for adequate breathing. Perform early assessment of the abdomen, examine the abdomen closely, look for decap BTLS, look for hemoperitoneum, which is signs of bleeding in the peritoneal sac. Use OPQRST to assess history. So once we have completed the primary survey and addressed live threats, we should know what the patient's GCS is. We should know if it is a load and go patient. We should know if the patient requires a rapid scan. Next is a history taking. Use the OPQRST to assess history, obtain sample history, ask whether the patient has experienced any nausea, vomiting, or diarrhea. Ask about the appearance of any bowel movements. Once you have completed the history taking phase, next is secondary assessment. Obtain and monitor a full set of vital signs, focus on isolated injuries, perform physical examination, look for contusions, abrasions, and hematuria, which is blood in the urine, assess the patient's pain. Once we have completed the secondary, next is reassessment. Identify trends in pain and vital signs, communicate the MOI and the injuries, document the result of the physical examination, contact medical control for assistance. Assessment and management of specific injuries. Patients presenting with blunt injury need spinal motion restriction, high flow oxygen, PASG, may be used for an unstable pelvis. It depends on protocol. It's rarely used these days. Most abdominal trauma requires rapid transport to the closest, most appropriate facility. Closed/blunt abdominal injuries. Patient may have combination of injuries. Check for diaphragmatic or diaphragm injury. Monitor the patient's vital signs. For open or penetrating abdominal injuries, assume the object has penetrated the peritoneum and entered the abdominal cavity. Follow general procedures. Initiate two 18-gauge IV lines. For abdominal evisceration, do not push down on the patient's abdomen. Perform only a visual assessment. Never try to replace an organ that is protruding from the abdomen. Cover it with sterile gauze compresses. For injuries to the kidneys, signs of shock. If the injury is associated with significant blood loss. Another sign of kidney damage is blood in the urine. For the urinary bladder, suspected in case of blood at the urethral opening, or physical signs of trauma on the lower abdomen, pelvis, or perineum. Transport is determined by the presence of associated injuries or shock or of shock. For injuries to the external male genitalia, general rules to the treatment of the injuries include external male genitalia, general rules to treatment of injuries. Injuries are very painful. Make the patient as comfortable as possible. Never move or manipulate impaled objects or foreign bodies in the urethra. Identify and take avulsed parts to the hospital with the patient as needed. For injuries to the female genitalia, lacerations, abrasions, and avulsions should be treated with moist, sterile compresses. Use local pressure to control bleeding and a diaper-type bandage to hold dressings in place. Leave any foreign bodies in place and stabilize them with bandages. Bleeding may be heavy, but it can usually be controlled with local compression. Carefully evaluate contusions and blunt injuries. And that would be the end of this chapter.